I want to thank you folks for coming down and talking to our blog audience about the IRC and the techs that worked in IRC. Can you introduce yourselves?
Hi, my name is Brynne Williams, and I work as a tech, an MRI tech in the IRC.
Hi, I'm Lanier. I'm an MRI tech in the IRC.
Lacey Hass, I'm the lead MRI tech in the IRC.
Kaley Bridgewater, I'm a MRI tech in the IRC.
Kelsey Wineland, an MRI Tech in the IRC.
Well, thank you. So, can someone explain to us what the IRC is in Cincinnati Children's?
Sure. So IRC stands for Imaging Research Center.
Good.
We're the research part of the MRI at the hospital. So there's a clinical part and there's also a research part that looks at new types of imaging and developmentally things see how things translate. And so we work on that part that new imaging techniques can be translated to the clinical department. Anyone? Good?
Perfect.
I mean,
Yeah.
okay.
Is it all techs in the IRC branch, or who else do you work with?
So we're just one piece in the large puzzle. We work with a lot of PhDs, a lot of scientists. We also work with medical doctors, so we are integrated into the clinical side. We work with healthy kids. We work with sick kids. We work with coordinators, so we kind of have a mixed bag.
So, do you ever get a chance to work on the clinical side, not just on the research side, or is just mainly research for your group?
Does anyone else want to answer?
Sure. We primarily are research. We don't do any of the routine clinical imaging up in the department. Since our department is solely focused on research, that's what our position will have us do, is solely focus on research scanning, and they have separate clinical technologists that will handle the clinical imaging in the clinical department.
Okay. Well, again, thank you. And we have some questions that you folks get
First dibs. Who wants it?
asked all the time.
So, one question that we get asked by a lot of our family and participants when they come in for the IRC, they ask us, is there radiation involved in their scan? And we always like to inform the families that with MRI, there is no ionizing radiation like you would have in a CAT scan or an X-ray.
Okay.
So it's like the radiation that gets absorbed, right?
The
So no different
electromagnetic
than
radiation.
like normal everyday.
Normal like cell phones and other devices.
Yep.
Okay.
Another question. Are you a real MRI tech? Yes, we are. We all are certified in MRI. So technically we're interchangeable with the clinical techs, but our jobs are a lot different, so we'd have to, train
Additional
how
training.
to. Yeah, but we are, yes, have the same requirements as the clinical
Certifications.
techs. Yep. All right. Next up.
Oh, yeah. Okay. What can you see with MRI? You can see a lot of things, actually. A lot of stuff that you can't see with CT and X-rays, which is primarily focused on bone and skeletal stuff, things like that. So with MRI, we can see a lot of soft tissue things, like livers and hearts and brains and things like that you can't necessarily see. Well, you see them on other scans, but differently. So we get a different perspective and a different view of different parts of your body and different organs and stuff like that. See how they function differently with MRI.
Okay. What type of schooling do you need for MRI? So some of us have bachelor's degrees, some of us have associates, and some of us just have certifications, so it really all depends across the board.
Likewise, in schooling, is there an average, 1-2 years, or it just depends on the institution that you go to?
Depends on the institution, I would say.
Yeah, and
Yeah.
probably, so 4 of us out of the 5 have graduated from UC, the Advanced Medical Imaging and Technology program. And with that, you get a bachelor's degree and certifications in 2 modalities. All of us coincidentally chose MRI and nuclear medicine. But you can also go through a certificate program. So on average, nowadays, it's probably a bachelor's degree as before it was probably more of an associate's or a certificate.
Yeah, you have to have an associate's degree now before you can even sit for the boards.
So times are
Whereas
changing.
I went through a hospital-based program to obtain my x-ray license, and then I went through Kettering College of Medical Arts in Dayton through a certificate program before they passed those rules.
Yeah.
But I'm currently pursuing my bachelor's degree.
But once you hold your license, everybody's still required to, do the same continuing education, and so we all have the same requirements as far as like before you can sit for your boards, and then after your boards to maintain your credentials.
Yeah.
Yeah.
All right, my turn. Does it hurt? No, it does not hurt to get an MRI. The most important part is to hold really still, and the machine does make a loud knocking noise, but we'll give you earplugs and ear protection for that.
Okay.
What does contrast do? So sometimes they need contrast to look at different parts of the body that is hard to see otherwise. So sometimes you drink something so we can see your belly better. Sometimes you actually get an IV and contrast is inside your blood. So it makes things show up differently to answer different questions for the doctor. Next.
Why is it so loud, and do I need earplugs? It is so loud because we have these things called gradients that work actually inside of the magnet that are working really, really hard to do a lot of technical things with changing magnetic field and whatnot. But because of those gradients, it does make a really loud knocking noise like Kelsey described before. And so when you come, if you do come to the IRC, we will give you headphones and earplugs, which will hopefully block out a lot of those noises and help make the scan a lot better for you.
Yeah.
Yeah.
No
Yep.
pictures without the sounds.
No pictures without the sounds, unfortunately, yes.
Now, do you have goggles that patients can or watch movies on?
Sometimes, yeah. Sometimes they give goggles, or we have TV screens that they can see, like with movie projectors. We offer music a lot of times if people want to listen to music instead. They can listen to music through their headphones. So we do have a lot of entertainment options too while they're actually getting the MRI itself.
Okay.
Mm-hmm.
What is fMRI? The fMRI is functional magnetic resonance imaging, and it's the same as a regular MRI, other than the functional MRI is looking at the brain over time, because we want to see the actual activation that's happening in the brain. So if you're watching a movie, there's the visual part of the brain that is working, so we can see that, but that part of the brain is working, has greater activation than the surrounding areas of the brain. The same as if you're tapping your fingers, we can see that part of the brain along the motor strip that would be activated more so than the surrounding tissue, so that scientists can pick that out. So there's various studies that we will do that uses fMRI to help them determine for literacy. They have kids that will go through interventions, pre and post, to see if they have improved reading, especially if they have a condition such as dyslexia. It's just one part of the studies that we do in the IRC.
Well, and they can also do it clinically, right? For surgical planning, if you have a kid that's you're looking at a tumor and they're trying to figure out the best way to do the least amount of disruption in the brain, they'll have them do strategic tasks while they're in the scanner to identify those areas that they use.
We'll tackle this one together. Sure. Can I move? Well, you can move, but we would prefer you not to. Just like if you were to take a picture on your phone and you move around a lot, it's going to be blurry. So when we take a picture of you in the scanner, we want you to hold really still so we get a really nice image of whatever we're looking at.
All right. Got one more last bonus question.
Okay.
Okay.
I'm excited for this. Should be really good.
If this was a horror movie, who in the group would be the first one to go?
Oh boy.
Oh my.
Do each of us have to answer? Or should
I
we figure it out
hate
together?
horror shows, so
Okay.
probably me. I'd be out.
Like
Like die?
yeah.
Like probably me. I mean, I'm
Kelsey's
being
the
for real.
most trusting.
Yes.
So, open the
And I-
She'd be
yeah.
lured into the lion's den.
Yeah.
Don't go in the basement. What's down there?
Yeah.
Yeah. Yeah.
I
Unfortunately,
think I would overthink the situation, so I might go too.
Yeah.
That's hilarious.
I would make it till the end. I'm MacGyver-y.
Yeah.
Yeah, you would.
I'm quick.
Yeah.
Not me.
I don't know who would go first, but I know it wouldn't be me.
I don't think it would be you either.
I don't think it would be Matt either. Yeah.
He's too strategic.
Yeah, I'm like, I'm not gonna, that sounds like something scary is coming from there. I'm out. I'm going.
Let's do it.
I might agree
I
with
just feel like
Kelsey and
I-
her. Yeah. Sorry, girl.
You're gone.
Yeah.
I'm out. It's all right.
Yeah.
I'm fine with
I
that.
think she would vote herself out. Like,
I would.
think she
Yeah.
would be like,
I can go.
don't wanna do
I don't
this.
like
Yeah.
this. I hate scary stuff.
I actually never
I'm out.
wanted to be in a horror
Yeah.
film, so I can
No.
just go.
Well, thank you for coming
You're
down
welcome.
and
Thanks
then
for
give us
having us.
Yeah.
some of your time and introducing yourselves and the IRC to our audience.
You're
course.
welcome.
Thank you.
Thank you.
Thanks,
No
Lynn.
problem.